Hello, my name is Amy Marston, and I am doing a portfolio and a systematic literature review. And my project is focusing on the barriers to healthcare in rural area settings. Um, I'm going to be doing a correlation of the expected course objectives, and I'm going to compare those to my experience, focusing on analytical thinking. So, most recently, I have worked with state and local data to assess a need for community health workers, the lack of hospitals in 3 of our 4 counties that we serve, limited primary care providers, and no urgent care providers makes the need for in home assistance for some residents to reduce their need for urgent and emergency services much more important to keep them out of the hospital and to keep them safe in their homes. As far as collaboration, we work with local FQHCs, which are federally qualified health centers, to ensure that services are available, but that we're not providing the same services in each location. This is to ensure that the services that we're providing are meeting the needs of the community, but not an overabundance of the same needs that may not be necessary. Communication. As a manager of 25 employees in 4 different counties, I do my best to communicate with all staff. I have what we call a Thursday talk every other Thursday. That is a Zoom meeting that I have with all staff where they can kind of come through and give their suggestions, comments. We can discuss any questions or anything that might be coming up. Most recently, the biggest topic is, of course, has been on the measles outbreaks that have occurred in the United States. We have actually had, to date, only one measles case in the state of Kentucky, thankfully, but there have been some other scares. I hold in person quarterly meetings, so every March, June, September, and December, I hold in person meetings where we all come to one location. Twice a year, I perform surveys with my staff. They are anonymous surveys, basically asking what they think that I can do to help them, either by what I'm not doing, what I need to be doing more of, things like that. And then I have suggestion boxes in all of the health centers that they can drop any suggestions they may have. In addition, we have 3 meetings for our whole district throughout the year. Process management. Since becoming a community health manager, I have implemented annual policy and procedure reviews. So there is a clinical services guide that comes out that basically tells what we can do in our practice, and we review that after it comes out every year, which is around April or May. But we also review every policy and procedure on anything that we do. Like we've recently implemented Title X family planning. We will review that and make sure that what we're doing is following state and federal guidelines, but also is working to make sure that we are meeting the needs of our communities. Project management. So we receive annual funding from some of our allocations from some of our programs. One of those is known as the MCH program, which is maternal and child health. So managing that program every year, we're given what our allocation is. We've actually lost 4,000 from last year to this year, so we've been working on that. And in doing that, we have to figure out, we have 2 packages that we have to do. We have a minimum of 3 that we can do. So we have to figure out what's going to best suit the pregnant women, new moms, infants, and children up to 18 years of age by the services that we provide. Self-development. I feel like communication and leadership are the 2 places that I still continue to work on as far as self-development goes. And that's because I came from a background of not having to supervise or guide, and I've been doing this for about almost 7 years now. And in doing that, the environment is different, the services are different, so I've had to adapt, and I'm still learning to adapt in those areas. And as far as strategic organization goes, many of the grants and funding sources that public health receives require us to analyze the outcomes and ensure what we're doing is what's best for our communities. Like I said previously, we're very limited on our funding, and trying to figure out that we're putting the money where it does the best work is where we have to focus. And that's where I think I work on the strategic organization, and that's making sure that we're applying the money where it serves the purpose best for the communities that we serve. I wish everyone luck and thank you very much.